the principles of experimental design. Your book breaks it down into 4 principles. So the first principle of experimental design is comparison. You need to make sure that when you set up your experiment, you use a design that compares 2 or more treatments to each other. So if you remember yesterday, we did an example with medicine. They wanted to know the absorption of the medicine, so they gave 25 people 1 dose of the medicine and looked at the concentration afterwards. If we were looking at that, did they utilize this first principle of experimental design? Did they have another group to compare to? No, they didn't, right? So comparison means we have to have at least 2 treatments that we can compare. So maybe they wanted to change the dose and see if changing the dose affected absorption or something like that. So when you're setting up your experiment, you have to have more than 1 treatment so that you can compare those results across the different treatment groups. So that's the first one that's very big. The second one is you need to establish control of the environment as much as you possibly can. So keeping variables that might affect the response the same for all groups. So in your experiment, you might call for volunteers to show up and help out with the experiment, and then you might pick and choose from those volunteers to make sure that the people you select all have certain qualities. Okay? Maybe they're all smokers from the age of 18 to 25. Maybe they're all people who are overweight and smoke, or whatever it might be. But you're choosing people based on certain characteristics so that all of your subjects have those same characteristics overall. You also need to keep the setting for all of your experimental units the same. So throughout the experiment, you should not have different scenarios occurring with your different experimental units. If one group is taking some sort of pill, all groups should take some sort of pill, whether it's actual medicine or not. If you're having groups do a certain activity, all groups should be doing some type of activity if possible to keep things the same throughout. Okay? So as far as control goes, that kind of covers a broad area. You need to try to control and limit any sources of maybe possible lurking variables or confounding and variables that could affect the response. You want things to be as similar as possible for all of the experimental units as you go through the process. Okay? So that's the second one that you need to make sure you have. Randomization. This one is extremely important. You must randomize your subjects to the different treatment groups to even out any effects that cannot be controlled. Should be an E. That bothers me when people mess those up. So randomize subjects to treatments to even out effects that cannot be controlled. So as much as you possibly can, you might try to get the same type of subjects within your experiment. You might try to make sure that the different treatments are set up fairly similarly throughout. But you need to randomize to make sure that if you missed anything, those values or those items that might cause changes will be spread throughout the different treatments so that it's not just one treatment group getting all of a certain characteristic, and then now we no longer know if the differences were because of that characteristic or because of our treatments themselves. Okay?
So can randomization not only apply when you're using people that you're studying on since it's like subjects?
No, and that should say randomize experimental units because whether you're working with inanimate objects or animals or anything like that too, you still want to randomize the units to make sure that those characteristics are spread throughout if there are any that are possible problems. Okay, so yeah, this should probably say randomize the units to the different treatments to even out the effects. The other reason that this is so important, this whole randomization, is because if you think about the process of an experiment, when we talk about sample surveys, the big thing, the one thing that all of our different good sampling techniques utilized was randomization. So we had simple random samples, stratified random samples, clusters we chose randomly, systematic we chose a random starting point, right? So everything utilized randomization so that our sample was selected randomly. Now if you think about an experiment, if you're going to be trying out a new drug or you're going to be trying out whatever it might be, would it necessarily be ethical for you to randomly select a group of people, go out and just grab those people off the street and say, hey, you're part of this experiment now? It's not something you'd really be able to do. So based on the way experiments are set up, you're going to get a voluntary response sample. You're almost never going to get one where you can actually randomly select your particular sample. Now, if it's inanimate objects, yeah, you probably could. Animals, you could probably get away with that too. But as far as people go, you can't force people to be in part of an experiment. So you're going to get voluntary response samples, which means you need to counteract that with the control you exert over selecting from that voluntary response and randomly assigning people to the different treatment groups. So you need to get rid of that voluntary response bias that you normally accumulate and try to limit that as much as possible. The fourth principle is called replication. When we talk about replication, what we're talking about is the use of many experimental units in each treatment group to reduce chance variations in the data. So basically what you have to keep in mind here is when you create your different treatment groups, you need to make sure that you are putting enough people or items or animals into each of those different treatment groups to counteract any chance variations that might occur. So if you only put one person into each of your different treatment levels or treatment groups, when you get to the end of the study, you don't know if the difference you observed was because of the treatments themselves or because there might have been a fundamental difference between the people you chose for each group. Maybe they just happened to respond differently to whatever you were dealing with. So you need to have numerous experimental units within each of your treatment groups to make sure that any of that chance variation can be accounted for within those different groups. So what they say here, a single subject is called an anecdote. It's not actual data. It's not something that you would actually be able to use as findings from an experiment. So if you only put one item into each of your different treatment groups, your findings are useless because we don't know if the differences we observe are because of the differences on those items or the treatments themselves. You have to have multiple subjects in each, or multiple units in each of the different sections. Okay with this? Okay, so part of what you're going to be expected to know is, given a scenario, how did they utilize each of these four ideas? How did they utilize comparison? How did they exert control? How did they use randomization, replication, things like that? So you have to be able to pick out the different parts to show that it's a good study. Now, some things to help avoid bias. So those principles, if you follow them correctly, should help you avoid any biases that might pop up. It'll also help limit confounding. Now, one of the ways we can do that, in most experiments, it's not going to happen in every single one, but in most experiments, you need to create what's called a control group. A control group would be a group of units that receive a baseline treatment. So it's kind of like the treatment of no change. what this control group allows us to do is compare. This is where a big part of our comparison comes in. So if you're trying something new, you would want part of your experimental units to exhibit or experience the new whatever it is you're testing, but you want half of your experimental units to experience the old whatever it is you're testing, so that you can see if there is actually a difference between the new and the old. So when we're talking about a control group, we're saying, okay, this control group is going to keep things exactly like it is now. We're not going to change anything for them. We're only going to change for the other groups so that we can compare any differences that we see. Okay? Now, when you are creating a control group, you are going to give the control group what we call a placebo. You guys all heard that term before? Okay? So a placebo is a dummy treatment used for a control group. We said at the beginning, or before, we want to control the environment as much as possible, and part of that control is making sure that the experimental units experience the same things throughout the different treatment groups. We want things to be as similar as possible throughout. So, if we have something where we're testing a medication, if we give one group some form of medication and we don't give the other group anything, we run into a problem there. And the problem we run into is that with placebos, we have what's known as the placebo effect. That's something I hope you guys have heard of as well. The placebo effect basically happens when subjects report changes even though they're not actually getting the actual medication. They're not getting the true treatment, but they're experiencing improvements or a change, though they shouldn't. Now, here's the problem. If we don't have a control group given a placebo, when we go to the end and compare, so if I had a group of people taking a medication and a group of people not taking anything, if we notice any differences, what happens is that placebo effect can take hold in both groups. So the people taking the medication can exhibit the placebo effect even on an ineffective medication. So they give the medication might not work at all, but because people believe they're taking the medication, they might start exhibiting improvements in whatever condition they have. That's the placebo effect. Now, if I didn't give my control group a placebo, they know they're not taking medication, well, they're not going to exhibit improvement, right? And so when I see a difference, if I see any sort of improvement in the actual group, I don't know if that's because the medication actually is effective or if those patients are simply exhibiting the placebo effect. Does that make sense? If I give a placebo, so I have one group taking the actual medication, another group taking an identical looking medication, but it's not anything, like maybe a sugar pill or something like that. If I see a rise in improvement in both groups, that's going to tell me that the placebo effect took hold. The medication probably is not effective because both groups improved. Now, if the medication group improved significantly compared to the placebo group, then we'd have a different discussion. Now, some of those people might have exhibited the placebo effect, but the majority probably improved because the medicine was in fact effective. Does that make sense? So that placebo group has to be in place because you might see improvement in both groups based on that placebo effect alone, which means the medication's not effective, and we wouldn't catch that if we didn't give the first group or the control group something as well. Okay? So when you use a control group, you have to give some type of placebo. So medication or medical studies are usually the easiest to kind of draw an example from, but it could be anything. You need to make sure that they're getting something so that they don't know what group they're in. Okay? Some more things. more aspects of experiments that you should be utilizing to try to make your results as useful and accurate as possible. You should always, at the very least, employ some sort of blinding. Now, in some experiments, there's nothing you can really do as far as blinding would go. So let's say you were trying 3 different exercise programs to see which one was the best. So you might have, I think from your example coming up in a worksheet later on, you might have like strength training, general conditioning, and aerobic conditioning. So if you're looking at that, when you assign the people to the different groups, are you going to know what type of exercise you're getting? Yeah, and there's no way to blind that. You can't make strength conditioning look like general conditioning, look like aerobic. There's just no way to do that. So whenever possible, you should try to implement blinding. But in some cases, especially if it's something you're physically doing to the subjects, it might be a little tougher to do. Okay? But in blinding, the experimental units have no idea which treatment group they're actually in. This is extremely important in medical studies when they're trying out new medicines. You do not want either group to know whether they're receiving the true medicine or whether they're receiving the placebo. So with blinding, they don't know what they're getting, and that's where that control group, that placebo, comes in. If someone's getting a pill for the medication, the placebo group needs to be receiving a pill that looks exactly like it. If they receive a shot, the placebo group needs to be receiving a shot. The experiences have to be the same, so that the people don't know which they're getting, the medication or not. And that's to sift out that placebo effect. Okay? Now, if it's possible, even better than simple blinding would be making your experiment double blind. With a double-blind study, those administering and evaluating the results, as well as the experimental units, do not know what treatment is being used. So in a double-blind, those administering and evaluating, as well as the experimental units participating, do not know who's getting what. Why would this be important? So we know that blinding, making sure the experimental units don't know what they're getting, is important because it sifts out that placebo effect. But why wouldn't we want those administering or those evaluating the results? Why wouldn't we want them to know who's in which group? Because they may treat them differently. People are very good at picking up nonverbal cues, right? So if someone reacts differently because they're giving medication to someone versus giving just a placebo, there might be something you pick up, something in their actions that leads you to know which group you happen to be in. Okay? So as far as administering goes, you don't want them to know who's getting what because you could subconsciously treat them differently somehow. Okay? Even with studies in plants, if you're trying like fertilizers or different types of watering and things like that, they've actually done studies that show if people talk to plants, they tend to grow taller, faster, better. So if you know which plants are getting which special treatment and you are treating them even differently, they've been shown to react. So it's something that you have to be careful with as you go through. With double blinding, you don't want the people giving out the medication or giving out the treatments to know necessarily what they're giving. So they can't give any clues to the subjects. Does that make sense? Now, that takes care of the administering. Why wouldn't we want the people evaluating the results to know who was in which group? Because they're going to draw the conclusions they want to draw. Remember, we can make the data look however we want. We can make it look as good or as bad as we want to based on scales, based on what we report, things like that. So if it's a pharmaceutical company that really wants a certain medication to work, you better believe if they know who got the real and who got the fake, they're going to try to push as much as they can to show that the real worked. Okay, because that's money for them. If they don't know who was in which group, they have no idea which data to work with. And so they have to report those results truthfully. Now, the way that works then, somebody has to know who got what, otherwise the experiment's totally useless. So generally, you would have somebody that's on the sidelines, they have no part of the actual experiment themselves, but they would have a key of some sort. These participants were in the medicine group, these group participants were not, or in the placebo group. So you have to have somebody that knows the key, who was in who, but they shouldn't have any part of the actual evaluation or administering or anything like that. Okay? So double blind, the best. If you can do it, you need to try to do that. Any questions on that? Okay? Another thing you want to avoid as much as possible is what we call a lack of realism. So doing something within your experiment that leads people to, or like leads them a certain direction. So something that's not realistic as far as what they can expect normally. The example that we generally use, so subjects, treatments, or settings of the experiment is not realistically duplicating true conditions. So if something within the experiment isn't duplicating true conditions that people would experience. For instance, in our TV ad experiment, if people knew going into the experiment that they were supposed to be looking for commercials, so if they're coming in to watch a program, but you mentioned something that commercials are the thing, or your whatever group is running it, you're conditioned to start looking for those commercials. Whereas if you were watching TV normally, what do you tend to do with commercials? Yeah, you tend to not pay attention. That's the time you start talking to anybody else. You get up and go grab something from the other room or whatever it might be. If you recorded it or recorded the show that you're watching, then you would simply fast forward through them, right? So that would be a lack of realism. People are knowing to look for those commercials, which we normally don't. So they're more likely to remember different aspects of it. So it might be something you have to disguise a little bit as far as the true nature of the experiment. Does that make sense? All right. So overall, when you're setting up an experiment, the best experiments are usually randomized, comparative, double-blind, and placebo-controlled. Now, as we mentioned throughout, it is not always possible to do all of these things. It doesn't mean that that experiment is bad. It just means that the conditions didn't set up or allow for these 4 principles to be utilized. So there are times where you might not be able to blind the subjects or the evaluators from who's in which group. It doesn't make that experiment any less accurate or any less useful. It just means they weren't able to use it. Placebo control. There might be times where you don't have a control group. So if you don't have a control group because of whatever situation you're running, you don't have a placebo. Doesn't make that experiment any less useful or accurate. It just means they couldn't use it. So when we say the best experiments, the usually is key here. Usually you want to do this. If it's possible, you need to use all 4 of these aspects. If it's not, you need to use as many of them as you can to make your experiment as good as you can. Okay with that? All right, so let's talk about how to diagram an experiment. So one of the things you're going to be asked to do is explain how you would set up an experiment. So part of that is explaining. So writing out in words, here is what I would do for this particular experiment. But a shortcut for some of that is using diagrams. You can actually diagram it out to show people exactly what you'd be doing. How am I going to split my subjects up? What treatment's going to be what? How many treatments do I have? What am I going to be comparing at the end? So when you diagram an experiment, essentially there's going to be three parts to it. First, you need to identify who your experimental units are. So who are the actual experimental units you're running through the experiment? Are they people? Are they animals? Are they plants? Are they other inanimate objects? Are they some type of technology? Whatever. So what are your experimental units? Then you need to have a section that lists out all of the different treatment groups. What types of treatments am I going to be imposing on these experimental units? And in this section, you're going to be talking about how many subjects or experimental units are in each group. So not only what types of treatments am I imposing, but how many of my subjects will go into each of these treatments. And then at the end, it should all come back together to show what you're comparing. What was your response variable that you were trying to measure? Okay? So, when you draw your diagrams, most of them are going to look something similar to this. This is kind of the easiest way to diagram what your experiment's going to look like. So you identify your experimental units. You note, and in your design, you need to always note that when you allocate your units to the different treatment groups, you are randomly assigning that. So the easiest way to do that, or the way I normally do that, is when I draw my arrows to start splitting, I just say we perform an SRX. So you're going to randomly select from this group. The first half go into group 1, the remaining people go into group 2. Or if I have 3 different treatments I'm applying, the first third go into group 1, the second third go into group 2, the rest go into group 3. But you are assigning them by using an SRS. So you have to have this noted in your diagram, that you randomly assigned the different subjects or experimental units. So then you're going to say, you have group 1 and group 2. How many subjects are in each of those groups? And then, which treatment does group 1 get? Which treatment does group 2 get? If you had more than 2 treatments, what treatment does group 3 get? What treatment does group 4 get? And so on. And then at the end, you bring it all back together and compare the results of that response variable. So what were the actual values that we recorded for our response variable? Okay? So when you're asked to describe your experiment, one of the things you need to be able to do is diagram it out. What does it look like overall? And then just give a few sentence description of the process itself. So, randomized comparative experiments. We kind of already discussed this in the principles of experimental design. It's an experiment where we have both comparison and randomization. We randomly assigned our subjects to the different groups, and we have multiple groups, obviously, for comparison. So when it says design a randomized comparative experiment, it's just saying show how did you randomly assign the groups, how many groups did you have, what were the different groups. So you're basically just diagramming out what we saw on the last slide there. Okay? So an example, and this is an example I believe from my old book, but they wanted to test nutrition in breakfast food. So they had a new breakfast food that they wanted to try out to see if it held the nutritional qualities that they were looking for. Okay? So what they did was they took 30 white mice and they split the white mice into 2 groups. One group got this new product, the other half got the old product, just what they normally would eat or what they would normally eat on a given day. And what they did at the end of the study was measure weight gain after 28 days of consumption. So if we were diagramming out this experiment, we would start with our experimental units. So we started with 30 white mice. We took those 30 white mice and we randomly separated them into 2 separate groups. So 15 white mice went into group 1, 15 white mice went into group 2. When you diagram these out, this is what it needs to look like. Now you don't have to put boxes around yours, but you need to have the information provided. So what were your actual experimental units and how many? How many went into each of the different groups? Make sure you have something that shows random allocation, so SRS or say randomized. So group 1 received the new diet. So they got the new product they were trying to test out. Group 2 stayed with their standard diet. They didn't change anything, which means group 2 would be what? The control group. So group 2 is our control group. Here's where our comparison is going to come in. Okay? And so once they did the 2 treatments, at the end, they compared weight gain between the 2 groups to see if the new product, the new diet, was effective overall. Okay with that? All right, so I want you to try one. Just in your notes there, I want you to diagram out the following scenario. An ad for Opti-Grow plant fertilizer claims that with this product you will grow juicier, tastier tomatoes. You'd like to test this claim and wonder whether you might be able to get by with half the specified dose. So how would you design an experiment to check out this claim? So I'll give you a minute or two. Take this scenario. All I want you to do is diagram out what this experiment would look like. So what are your experimental units going to be? How many are you going to use? How many different groups do you need to create? Because of how many treatments you're creating. And then what are you comparing? What's your response variable overall? All right, so if we right there, draw this diagram out. What are my experimental units? Tomatoes, right? So, how many tomatoes do I want to use? 50? 60? 27? Is there anything I have to keep in mind when I set the number that I'm going to use? How many treatment groups I have, right? I need to be able to evenly split, if possible. I need to evenly split my experimental units into the different treatment groups, right? So how many treatments am I actually going to create here? I see 2, I see 3.
Full dose and half dose.
Without any without
All right, so don't forget, and this is the thing, when they give you multiple specifications, so full dose, half dose, some people assume that's enough comparison. But we need to know if this fertilizer even works at all to begin with. So we need to have it compared to no dose. With no fertilizer, do the tomatoes come out to be just as good? Because if so, then this fertilizer is useless. I shouldn't be wasting my money on it. So in this case, we actually do have 3 different treatments we need to create. So when I talk about the number of experimental units I have, I need to make sure it's divisible by 3. So let's say we use 60 tomatoes. Okay, and the number here doesn't matter. You can choose whatever you want unless it specifies specific, or it puts it in the problem specifically. So make up whatever number you want for the number of tomatoes you're going to use. Just make sure that you have plenty to split multiple tomatoes into each of the treatment groups. That's the main thing. So I'm going to take 60 tomatoes, and I'm going to create 3 different groups. So group 1 is going to have how many tomatoes? 20. So I'm going to randomly assign 20 tomatoes to group 1. I'm going to assign 20 tomatoes to group 2. And 20 to group 3. Now if I was describing this process, because part of what we need to do when we diagram is also explain. When I just say SRS, people who don't know anything about stats don't know what that means. So if I was going to explain this process, what would I do? How am I taking an SRS to get 20 tomatoes in group 1, 20 in group 2, 20 in group 3? What do I need to do with these 60 tomatoes right off the bat? Label them. So I'd have to give each tomato a label from, okay, either 0, 0 to 59 or 0, 1 to 60, depending on which way you want to start it, right? So I'd label them, and then I would use either a calculator or the random table, the table of random digits, chosen or starting at a certain line, starting at a certain seed, and I'm going to generate 20 unique labels. So 20 unique numbers to get group 1. As soon as I have the first 20, that's group 1. My next 20 that I generate is going to go into group 2, and then all the remaining tomatoes go into group 3. So if you're explaining the process, you need to make sure you explain how to perform an SRS. Okay, so label your experimental units, choose the first however many for group 1, however many for group 2, and so on. So that needs to be something you explain with the process. Okay? So then the next thing, what is group 1 going to receive? Full dose? Okay, group 2 is going to receive half dose. And group 3 is going to receive no dose. So here's our control group. So that's my group that has no change to it. And the reason we need that, again, is for comparison. Do the tomatoes with no dose come out to be as good as half or full, or does the fertilizer actually work, in which case you want to use it. Okay, so you have to have that control group here. At the end, I'm going to bring these all back together and compare what? Yeah, you're going to compare the juiciness and tastiness. Okay, so you're going to see if fertilized tomatoes actually are juicier and tastier. And with that, you know how the full dose is going to turn out, but you're going to look at half dose. If there's not a difference between the two, then you could get away with only half the dose, which is going to save you money in the long run too. Okay, so lots of different aspects here that we're Analyze it. But this is what a diagram would look like for an experiment like this. Okay with that? So one of the big things when you're setting up your diagram, number one is figure out how many different treatments you're going to be applying so that you know how many experimental units you need to start off with, so you can split everything evenly. Okay there? All right. Here's your assignment.
Can I just